Hello everyone, in today's video I'm going to explain about a condition called atherosclerosis, a condition that's often called a silent killer because it develops over time and shows symptoms only when it becomes severe. Let's begin with what is atherosclerosis. It is the hardening and narrowing of arteries caused by fatty deposits, cholesterol and other substances collectively known as plaque. The function of the arteries is to deliver oxygen and nutrients to our organs and tissues, right? But when plaque builds up, it disrupts this flow and leading to serious complications. Even it may cause heart attack or stroke. Now let's see how this is developed inside the artery. Depending on the severity of the formation of plaque, it is divided into 4 stages. First one is endothelial injury. The process begins with when the inner lining of the arteries, that is endothelium, is damaged by risk factors like high blood pressure, smoking or high cholesterol. Then after this injury, the second stage is called plaque formation. Low density lipoprotein accumulates at the site of damage, and the white blood cells in our blood, which is a part of our immune response, try to clean up the cholesterol, but instead they can become trapped in the artery walls and contribute to plaque formation. And the third stage is called plaque growth. Over time, the plaque grows consisting of cholesterol, fat, cellular debris, and calcium. This causes the artery walls to thicken and stiffen, reducing blood flow. And the last stage, the most complicated stage, is called plaque rupture and clot formation. In some cases, the plaque can rupture and causing a blood clot to form around the rupture. This can further block blood flow and may result in heart attack or stroke. Let's see what are the causes and risk factors. There are several factors that contribute to atherosclerosis. For example, high blood pressure, high cholesterol. Let me explain it a little bit here. There are 2 types of cholesterol: low density lipoprotein and high density lipoprotein. LDL is also called as bad cholesterol because it can deposit cholesterol in the arteries and leading to plaque formation. On the other hand, HDL, it is also known as good cholesterol because it helps remove excess cholesterol from the arteries. But low levels of high density lipoprotein can increase the risk of atherosclerosis. Let's move to another factor, that is smoking. Most common causes nowadays. And another one is diabetes. As compared to healthy people, diabetic patients often have higher levels of high density lipoprotein and low level of HDL. And again, it will further contributing to atherosclerosis. And another factor is inflammation. Chronic inflammation in the body. It might be because of many reasons like infections or autoimmune disease. It can also promote the development of plaque. Other factors like obesity, sedentary lifestyle, all these factors are modifiable factors, but there are some factors which are non-modifiable. It's not up to you, and you cannot change the fact that the atherosclerosis is developing inside your artery. So let's see what are those non-modifiable factors. Number 1 is genetic. Family history. A family history of heart disease or other vascular conditions can increase the risk of developing the condition. And the other factors are age and gender. The risk of atherosclerosis increases with age, and as compared to female, male tend to develop it little earlier. Although the risk for female, it rises after menopause. In the early stages, it might not show any symptoms because the arteries can still supply adequate blood to the organs and tissues. However, as the condition progresses and if it affects the heart, a person might experience symptoms like chest pain, breathing difficulty, fatigue, or even heart attack. And the another cases may be stroke. It occurs when the blood flow to the brain is reduced or blocked. And in the limbs, it can lead to delaying of wound healing, and then it will lead to gangrene or the need of amputation. Moving to the diagnostic evaluation, atherosclerosis can be detected through different tests like blood test to check cholesterol and triglyceride levels, or to rule out the level of sugars in your blood, right? So blood test must be performed. The other diagnostic evaluation includes electrocardiogram to assess the function of the heart and to detect abnormalities caused by blocked arteries, and the echocardiogram, it is like an ultrasound that can show the heart structures and blood flow. Again, another test is stress test. It involves monitoring the activity of the heart while the patient is performing exercise or giving medication, mimics exercise, to check for signs of reduced blood flow during the activity. And moving to the last and the most important part of the session is treatment options. So let's see what are the treatment options. There are some factors which can help to minimize the complication of atherosclerosis, that is lifestyle modification. Having healthy diet that is low in saturated fats and trans fats and cholesterol can help control blood cholesterol levels and reduce plaque buildup. And do regular exercise and stop smoking. It is critical for reducing the damage of blood vessels and lowering the risk of atherosclerosis. Again, the most important lifestyle changes should be weight management. Achieving a healthy weight can help control risk factors like high blood pressure, cholesterol, and diabetes. Apart from this lifestyle modification, there might be a need for taking some medications. So the doctor will suggest you some medications like statins to lower your blood cholesterol, and anticoagulants to prevent blood clot, and medicines for high blood pressures and for diabetes. If even after getting the medication, the symptoms still persist or the condition getting worsened, then there will be a solution by undergoing a surgical procedure or a small invasive procedure like angioplasty, a procedure to open up narrow arteries using a balloon or stent. For severe cases of coronary artery diseases, bypass surgery may be needed to restore blood flow to the heart, and the surgery is called coronary artery bypass graft. Or a carotid endarterectomy, that is a surgery to remove plaque from the carotid arteries to prevent strokes. So that's it for today's video.